You may have clicked on this video because you're having thoughts right now. Is the relationship I'm in the right one? Is it good enough? Do we love each other enough? Are we intimate enough? Every person who is in a relationship will have doubts at times. It's a normal, natural human experience. But if there comes a point where you find yourself continuously asking these questions, seeking reassurance, doing all sorts of behaviors, either mental or physical, to try to prove to yourself that the relationship is fine, you might be moving towards something that we call obsessive-compulsive disorder. And one of the subtypes of OCD is relationships. My name is Dr. Patrick McGrath, and I'm a licensed clinical psychologist and the chief clinical officer for NOCD. Now you might think to yourself, isn't OCD just cleaning things too much, or checking to make sure the stove is off, or making sure that things are in a certain order? Well, no, it's a lot more than that, actually. It takes on so many different forms, and one of the forms is about the relationship that someone's in. So the first thing that I want to let you know is that I obviously, in this video, am unable to diagnose you, right? That is not going to happen here. I do want you to know that there are great therapists out there who are licensed, who are able to work with you to see if obsessive-compulsive disorder might be what's actually going on. What we'll do today is walk you through how you recognize what OCD is, what's the cycle that it follows. I'm also going to show you some things that you can potentially do right away to help yourself get through this experience, and at the end, give you some links so that you can reach out to people who might be able to help you if this sounds like something that's occurring in your life. If you find yourself in a relationship where there might be physical or mental or emotional abuse occurring, that's not the doubts that we're talking about here. OCD is occurring internally. The doubts and insecurities are coming from yourself, not from other people. If you do find that there is abuse occurring, please reach out to the National Domestic Violence Hotline at thehotline.org. You see, at its core, obsessive-compulsive disorder is really about doubt. That's why it's even nicknamed the doubting disorder. And if OCD can find doubt in something, it will start kind of picking at you and saying, well, maybe this and maybe that. But it could also lead you to do certain behaviors to try to get some instantaneous, immediate relief. The first occurrence might be a trigger. There it is. Something along the lines of, they seem to hold hands more than we do. When you see that, there might be an obsession that occurs. Do people love each other more than we love each other? Are people's relationships better than ours? That brings a lot of doubt into the relationship. You move toward the compulsion. I gotta find an answer to this. I need to know if our relationship is good enough. So what am I going to do? I'm gonna take relationship quizzes online. I'm gonna pester my partner. Do you think we love each other enough? Are we intimate enough? Is there enough time that we're spending together? And you may get some answers to those things. You may be told, yes, I love you, and yes, we spend lots of time together, and you may even score 100% on that relationship quiz, and you might feel good for the moment. But that relief is often fleeting, unfortunately. You see another couple holding hands and notice that you're not, and the cycle starts all over again. And after a while, you don't even need to see that. You just have doubt, and you seek constantly to get rid of that doubt. But what's one thing that we know? You can never give OCD enough information to the point that it will stop doubting, to the point where it said, you know what, you're right. You are in the perfect relationship. Everything is wonderful. There's nothing to worry about whatsoever. It may come to surprise you that as much as you want people to give you that information, to make that doubt go away, that might actually be contributing to the very OCD problem that you may be experiencing. So when we're working with people who have this, it's not about trying to remove all doubt about the relationship. It's about getting them to recognize they can handle having doubt about the relationship. The treatment for obsessive-compulsive disorder involves exposure and response prevention therapy, or ERP. First of all, we're purposely going to expose you to things that are uncomfortable. Now, you're being exposed to those things all the time. Those are your obsessions. But the really, really essential component of treatment is response prevention. And that is teaching people to not do their compulsions, to not respond to the obsessions in the typical way that they have been responding to them. So through exposure and response prevention therapy, we're going to teach people to live with their discomfort, allow it to be there, and know that they can handle it. Our goal is to recognize, I can be in a relationship and I can have doubts about it, and I can still be content in the relationship that I find myself in. And you can learn that doubt is just a normal part of the world and the relationship that you find yourself in, and it doesn't have to have an answer. You might find yourself right now in the throes of a doubt about your relationship. I want to walk you through something different than what you've done before. Your goal right now might be, I really want to know the answer. I have to get this reassurance. Are we in love enough? Is there enough there? What if other people love each other more than we do? And if I could just ask my partner one more time, though I've already asked them 50 times today, I know this will be the time that it will feel right and everything will feel good. And yet you also know that that's not the case, that that's a lie that obsessive-compulsive disorder tells you. I'm going to highly encourage you to not ask that question, which would feel good in the moment, but doesn't ever give you the answer you're really looking for. Instead of doing that, I want you to continue to be there in that feeling of doubt, in that feeling of insecurity. And I want you to allow it just to sit. Now, it isn't surprising if you actually notice it start to feel worse. That's typically what happens at first. That's your OCD screaming at you saying, you must now have an answer. I want you to start thinking, I'm noticing something that I've never allowed myself to experience before. I can handle it. I may not like it, I may not be comfortable, but I can handle it. That's the key in this entire experience. If we allow that just to be there, just to stay, over a little bit of time, you'll notice it hits a peak, and then it's going to start to eventually come down. There will always be doubts. There will always be insecurities. It doesn't matter if you have OCD or not. Those are experiences that we have in relationships. But is OCD going to help your relationship? Well, think about that for a moment. Does your partner love it every time that you ask them if you love each other enough? Or do they seem to get more frustrated over the course of the day? Turns out, reducing what OCD wants you to do improves your relationship, actually. So I encourage you that you try something like this. See what it's like. Apply some kind of aspect of ERP to your life. And when you're doing that, it's really great to work with a licensed clinician who knows how to diagnose and treat OCD, who can walk you through these experiences. You may ask, could I just go see any therapist that's out there? And unfortunately, not all therapists are trained at diagnosing or treating obsessive-compulsive disorder. In fact, many will even offer a generic kind of talk therapy, which unfortunately could involve a lot of reassurance giving and advice that actually turns out to be compulsions. So we don't recommend that you seek out just a general therapist for OCD, but you find a specialist who can truly walk you through the gold standard of treatment, exposure and response prevention therapy. It's important for you to ask any therapist you're going to see some questions, such as, do you utilize exposure and response prevention therapy for OCD? How much of your practice is focused on anxiety and OCD-related disorders? It is okay to interview several therapists until you find someone that you're comfortable with and who gives you the right answers. Yes, I use ERP to treat obsessive-compulsive disorder. And yes, I treat a lot of people who have anxiety and OCD as well. There's multiple ways to find qualified therapists who specialize in obsessive-compulsive disorder. The International OCD Foundation has a very large directory of people, iocdf.org, and so does NOCD, or NOCD.com. When you work with NOCD, you'll start by doing live face-to-face sessions with your OCD therapist, but here's something that's really unique. Between sessions, you can get always-on support. That means you can message your therapist between sessions. You can join our peer-led support groups, and at any time, use the NOCD platform for self-help functionality and support as well. I'll include a link in the description below, as well as resources from Healthline to help you with your intrusive thoughts about your relationship. Know this, you can get help.